Welcome to H&HN Daily. I'm Suzanna Hoppszallern, Senior Editor for Hospitals and Health Networks magazine. Today I'm joined by Brian Doerr, Senior Vice President, Information Technology and Security Officer at Community Hospital Corporation in Plano, Texas, to discuss Meaningful Use Stage 2 today. Welcome, Brian.
Thank you for having me.
So what are the challenges that hospitals are still facing?
Interoperability is going to be a huge challenge for our hospitals. I would also say internally creating both improved, efficient workflows for our physicians, for our clinicians in general, is going to be a critical challenge. And I'd say the third challenge I see is a huge challenge around security.
Can you spell out a little bit more about what kind of security challenges are we facing? This has come up a lot in the news lately.
Yeah, as you've seen in the news with the Anthem breach, with other breaches around the country, I think our hospitals have been so focused on delivering improved services for physicians, for clinicians, for financial staff, and for patients that they've done that in lieu of focusing on providing that in a completely secure environment. There are so many challenges that they face and they're trying to deliver on that they many times don't focus on making sure that they do all of that work in a secure fashion.
The other issue that comes up a lot are the workflows. Yeah. And can we improve the workflows while we're working on stage 2? It's really critical for this stage of meaningful use.
I would completely agree. In fact, I tell people a lot of times I feel like the processes that our technology enables today feel like physicians conducting surgery in the late 1800s with those types of tools. The tools that we have, while great and much improved over what we've had in the past, are still rudimentary when it comes to driving efficient workflows that provide clinicians with easy access to patient information and documenting that patient care successfully and efficiently.
What about the vendors? Are they keeping up with the demands for upgrades, and are they going to be able to deliver?
I think all vendors are having challenges keeping up with all of the requirements from both a meaningful use, ICD-10, as well as facility requests. I haven't seen a vendor out there that can deliver on everything that every facility needs right now. I think they're going to continue to have those challenges until we get to kind of a stable playing field with the technology that we have. And I see that taking a few more years, honestly.
Is there a way an organization can prioritize to make sure that they're keeping in step with their plan, with their vendor?
Well, I think honestly, facilities need to invest in that clinical workflow or informatics role, and they need to have a laser focus on that at all points throughout their development. Even if they've already implemented a clinical workflow, they can look at how can we improve that, and they should be improving that on a daily basis, no matter their size. So I think a lot of facilities, as they move forward, should be focused completely on how do we drive a more efficient workflow with the tools that we have. It's always not the vendor that you've chosen. A lot of times it's how much effort have I put in to make it the best that it can be.
How is this stage 2 preparing us for the transition to value-based care?
I think a lot of the underpinnings of what you see in stage 2 around the reporting requirements and the data collection, although there's 900 plus new elements of data that need to be collected that fall primarily on nursing and clinicians to collect. I think providing and having that information gives us the information to help us manage a value-based workflow. I think that there's a lot of work to do, and I think having the resources, honestly, to manage and work with that information is going to be the big challenge for both urban and rural and community hospitals.
What can the hospital CEO and the board do to support the efforts of the organization?
Sure. I think they need to understand that the investment in IT is a continual one. It's not I buy a piece of hardware today. It's not that I've bought that 2 years ago and it's not paying off on my investment. It's a continual investment. It may go down. We may see a lessening in the requirements for investing in IT as we get more platforms involved and we can leverage the people to build the process. But it's really about understanding that and really listening and hearing that IT needs investment to enable more efficient workflows and better outcomes for patient care.
Thank you for joining us today.
My pleasure. Thank you for having me.